Hello, everyone. Welcome to another edition with BDO's partnership with Seeing Eye to Eye. And tonight we have a very special and informative conversation for all of you. And that is, we are going to be talking about all things sun protection tonight and all things eyes. Yes, sun protection, my Black people, and eyes. So, you know, we cannot have this conversation and this partnership without our esteemed guest doctors on the panel. So I want you all to listen carefully to their bios and profiles. And I also encourage you all to engage us in the chat. Let us know where you're tuning in from, and let us know if you have any questions related to sun protection and eye protection. So we definitely will be monitoring the chat for all of that. So we look forward to your questions and letting us know where you're tuning in from. But before I go any further, it is my honor and my privilege to introduce our first guest panelist. Her name is Dr. Nicole Pogue, and she is an assistant professor of clinical optometry at the New England College of Optometry. She earned her Doctor of Optometry from the University of Missouri St. Louis College of Optometry, and then completed a community health residency at the Dimmock Center in Roxbury, where she currently serves as the Eye Clinical Director. Let's welcome Dr. Nicole Pogue. Thank you so much for being here tonight. We're so happy to have you.
It's a pleasure. Thank you for having me.
Awesome. And our second guest panelist is Dr. Misha Faustina. And I will again want to honor both our panelists by reading their bios in full, so wait until you hear all of their accomplishments. Dr. Misha Faustina is an oculoplastic surgeon with an academic bent. In private practice, her clinical focus was on cancers, traumas, and aging issues around the eye, as well as cosmetic rejuvenation. She has established 2 ophthalmology residency training programs, one at the University of Massachusetts Chan School of Medicine, and more recently, at the University of Arizona College of Medicine, Phoenix. To quote Dr. Faustina, despite a global physician shortage, there continues to be a deficit in available training programs in eye surgery. I am working to expand the ophthalmology curriculum to include traditional and newer teaching modalities from Socratic to simulation. I want to promote collaborative relationships to further the professional goals of our medical students and postgraduate physicians in training. As a graduate of Meharry Medical School in Tennessee, she completed a general surgery internship at Washington Hospital Center in Washington. Dr. Faustina also followed this internship with an ophthalmology residency at SUNY Downstate Medical Health Science Center in Brooklyn, New York. She completed a fellowship in ophthalmic plastic and reconstructive surgery at the University of Texas MD Anderson Cancer Center in Houston. She is a board certified by the American Board of Ophthalmology and American Board of Physician Specialists. She has authored and co-authored book chapters and numerous articles in scientific journals and presented in local, national, and international forums as well as online. Please welcome Dr. Faustina to the panel.
Thank you. I'm happy to be here. Thank you for the invitation.
Of course, again, we are so happy to have both of you in this conversation. It is such an important conversation locally, nationally, internationally, but I believe it's especially important for our Black and Brown communities internationally, locally, globally, because there's so much misunderstanding around sun protection and even eye protection and eye care as it relates to the sun. So let's break down and kind of demystify a lot of the conversations around these topics. And I want to just dive right in. So Dr. Faustina, let's break the stereotype. What is the risk of skin cancer in African Americans? Because I often hear, we can't get skin cancer, we have melanin. Can we talk about the actual risk as an expert?
Yes, there is definitely a misconception that if you have darker skin, that you somehow cannot get skin cancer. And that I wish it were the case, but unfortunately, that is not true. Melanin is the body's natural skin pigmentation and it protects us from UV radiation. So it is true that while we are less likely to get skin cancer, we still can get skin cancer. One of the problems is that Blacks in the US, especially, tend to get some of the more scary kinds of skin cancers that can be misdiagnosed, like melanomas and squamous cell cancers. And those are the kind that can spread elsewhere in the body and actually threaten our lives. So it is important that we are vigilant, looking for the risk of skin cancer and that we pay attention to the fact that we can suffer.
Okay, Dr. Faustina, we're going to stick with you for a little bit.
Mhm.
Now understand that people with melanin, Black people, can in fact get skin cancer. And in fact, there are more dangerous types of skin cancer that we can in fact get. But do I need to wear sunblock? What is the ideal SPF sunblock if needed?
Right, right. Yes, we do need to wear sunblock. It is sunblock, not summer block. Not only use it in the summer, it is protecting us from the sun. So African Americans should wear a sunscreen, a sunblock every day to protect their skin from sun damage, sunburn, skin cancer. And while we, again, may be less likely, we still are vulnerable. Um, Sun damage can cause hyperpigmentation. We can get more age spots, definitely wrinkles. We can get sunburn. And again, we're at a higher risk for skin cancers that can not be detected until much later stages. And that's one of the reasons why we need to be aware of our risk of skin cancer as African Americans.
I love that you're saying this. This makes me very excited. I am first generation Nigerian American, which means my parents are immigrants from Nigeria, which is in the tropics, very sunny, but I was born here in the States. And I use sunblock on my face at least every single day, all year round. My husband, who's a Nigerian immigrant, laughs at me. Can we continue to set the record straight?
Glad you brought up the guys. So here's the thing with the fellas. Unfortunately, melanomas are 100 times more likely to develop in in Blacks than in non-Blacks, and much more deadly. Part of the reason why this is one of the areas where we still have some health inequities. African Americans are disproportionately affected by things like melanoma because we haven't really learned well, and we haven't really taught our future physicians well what the melanoma looks like on pigmented skin. Normally, when you look at a textbook, it's a picture of a brown mark on fair complexion. And there are not enough textbooks, although they're working to correct it. We need more textbooks and clinical photos of those who have pigmented skin who are suffering from skin cancer so that our future dermatologists and oculoplastics and all of the other specialties that may spot these will know what it looks like when they see it.
Interesting. And I'm curious to know what level of sunblock is needed for African Americans and how often do we really need to reapply? I put it in the makeup or on before my makeup in the morning. Do I really need to apply or reapply later on in the day?
Great question. SPF 30 or higher to your face and to everything that's exposed every 2 hours. So if you get in the water and you get out, or if you're sweating, then you want to reapply.
Wow. Okay, so I thought I was doing great, maybe not so much. Another question that both of you actually can answer, but Dr. Pogue, I'm going to go to you because we've been saying African American. Again, I get teased so much by my family members in Nigeria. They've never used sunblock in their life. Are either of you, starting with Dr. Pogue and then go to Dr. Faustina, aware of what those melanoma numbers or concerns look like for our Black communities globally? Is there a global concern? Is there a difference with people who grew up in the tropics, or is this a concern for us here in the West as African Americans? What is the global concern with Black people and sunscreen, if we even have studies on this?
Oh, I mean, that's a really good question. And I don't know that I have the answer to that. But Dr. Faustina, I don't know if you have a little bit more knowledge in that area.
Yeah, the numbers that I'm quoting are from an American study. Um, Blacks are 100 times more likely to develop melanoma than non-Hispanic whites, but Black men are at a higher risk of dying from it. And this is looking at statistics from 2011 through 2015. The 5-year survival rate for Black melanoma patients was 66% compared to 90% for non-Hispanic white patients. Unfortunately, squamous cell carcinoma is the most common skin cancer in Blacks. And basal cell, it can look different. So we want to, we can talk a little bit about what different skin cancers, I know that may come up a little bit later, what different skin cancers can look like. But there's research now going on out of Detroit that's looking at surveillance data to study the incidence and the survival of melanoma patients by race and ethnicity. That's showing Blacks are 3 times more likely than their white counterparts to have carcinomas that are much more, unfortunately, threatening their survival. So I don't have studies from outside of the US to compare.
And those are still staggering numbers and statistics that should give all of us enough concern, for those of you who live in America, concern about our skin protection as Black and brown people. But just because we don't know those studies or we don't have those studies globally does not mean that the concern doesn't exist. It's a matter of resources, it's a matter of access to research or access to clinical studies. So I'm still sending this to my husband. I encourage everyone watching to share this internationally, because we still need to be thinking critically about our sun protection around the world. And the lack of information or lack of studies does not mean that there isn't cause for concern. So long as you have access, we, the experts, are encouraging us all to use sunblock of at least 30 SPF and applying it every 2 hours. One more question for now, Dr. Faustina, before I go to Dr. Pogue. Should I be putting sunscreen on my eyelids?
Yes, please do. A large part of my career has been taking care of eyelid cancers. And it may be because people stop right at the orbital rim. It's okay to put it on your eyelid skin. Be careful, try not to get it into the eyes, but you want to go ahead and apply it to all of the skin that's exposed.
And Dr. Pogue, we just heard Dr. Faustina warn about getting sunscreen into our eyes. What happens if sunscreen does enter a person's eyes?
Yeah, so thankfully nothing too terrible will happen, just a lot of burning and stinging, and you're going to feel pretty uncomfortable with that. And so what we recommend is just really thoroughly rinsing your eyes. And so you can do that with tap water. If you've got eye wash handy, you can also use that. But for about 15 minutes, you just want to really flush the eye out, and that'll kind of get rid of the sunscreen. And the eye itself might feel a little bit irritated afterwards, and that's pretty normal also. And so using an artificial teardrop to help moisturize the eye is helpful. And if you're still having that irritation after a few hours, you can always call your eye doctor, and they could see you either that day or the next day to make sure that nothing else is going on. But a lot of times it's just feeling really irritated from having that sunscreen in the eye.
Great. So no excuse not to apply on your eyelids, because it sounds like a thorough rinsing for about 15 minutes with water should do the trick.
Exactly.
Staying with you, Dr. Pogue, what about spray sunscreen? I find spray sunscreen super convenient, but is that okay to use? And how do we put it on to protect our eyes if we are using a spray?
Yeah, so I agree. Spray sunscreen is super convenient to put on. Like Dr. Faustina said, you want to look for an SPF of 30 or higher is really what we're looking for. And the goal is as you're spraying it that you're not letting it just go away in the wind. You want to keep that can, that spray, that bottle as close to your skin as possible so that it is actually getting on the skin and not in the environment. And you can also spray and kind of rub it into the skin whenever you use it. So that way you're making sure it's getting covered. And I'm sure we've all had those streaks where you realize you missed a spot and the spray didn't get there. You can also put it on your face is okay too. And so to do that, you can either just close your eyes and spray on your face, or you can also just spray it into your hand and kind of rub it onto your face and neck as well. Both are equally as effective. You might find with the spray that because it is a liquid, putting it on your eyelids, it can kind of get into the eyes a little bit easier than the lotion, and so just being careful with that too.
That's great to hear. I was afraid you were going to say that it's not effective because it is my preferred method. And for those of you who do wear makeup, sometimes what I like to do is spray the spray on my hand when I want to reapply and just pat it into my face. And I do that a couple times to get the right amount of coverage. So that's another option for you who are looking to reapply the SPF 30 every 2 hours. I do want to pause and shout out to those who are watching live and those who are commenting. You are giving us what we wanted. Continue to let us know where you're tuning in from. Hey to T. Renee from Colorado. Thank you for joining. I see Jade from Florida. I see Pamela from Nashville, one of my favorite cities. And also I want to just kind of honor Baldwin Betty's comment. You shared that in the past year, your husband actually was diagnosed with several small basal cell carcinomas on his legs, and he always is keeping his skin covered. So it's another kind of example that Dr. Faustina was talking about with men being at risk for these types of cancers. Thank you so much for sharing your personal experience and your stories. My prayers are with your husband and we appreciate it. And we are just hoping for his wellness and hoping that conversations like this can help decrease some of those numbers and at least increase our competency and our understanding of what protection can look like. There is absolutely hope. So we ask again that you stop and you share this with your communities so that we can get the information out there from our experts on this panel. I also see that there are some questions about eyewear. We are going to get to all of that very soon, so make sure that you stay tuned. Okay, Dr. Faustina, we think about sunscreen in the summertime. I mean, I personally don't. I like to use it all year, but I will be honest with you. I use it all year on my face, but I do not necessarily use it all year on my body. So do we need to use it in other seasons also on like our bodies in the fall, our faces in the winter? And if so, why?
Yes, same rules apply. Anytime there's the sun, we need some sun protection. And you may be aware of going up or down on your SPF during different parts of the season. But be aware, depending on what you're doing, if you're out in the winter, the exposure off of snow can have a lot of reflection as well. So you still have a significant amount of risk. Reflection off of water can give you a lot of glare. And so there can still be a lot of risk. So depending on where you are and what activities you're involved in, you want to be aware of the continued need for sun protection.
Interesting. Okay, so all year round, so long as there is sun, your skin needs protection. I did not know that actually about the reflection from the snow.
I'm going to go a little further.
Wow.
Visible light is a risk too. So for all of those who hang out all day in your small smartphone or in your computer, the emitted light from those can cause some risk as well.
I sincerely did not know that because a lot of what I heard was after 4 p.m., you're kind of okay with not having to reapply, but Holding your smartphone to your face can expose you to risks.
Visible light.
Okay, I hope everyone's taking notes because, and thankfully this is recorded, so if you're not taking notes, go back and watch this. That is something I've but this is exactly why we have experts on the panel. So thank you for sharing that, especially in this digital, heavily social media, digital age. That's really, really important to know. Dr. Pogue, I'm curious to know what you have to say about this. A lot of these makeup and beauty brands have sunscreen in their moisturizer. Let's say I have one of those moisturizing sunscreens or moisturizers that have an SPF in it. Do I need to have sunscreen on top of that?
That's a very good question. So you want to take a look at a few different factors with that. So one, what is the SPF? So we're 30 or above is what we're shooting for. You also want to make sure that it's broad spectrum as well, and so UVA, UVB protecting. So those are kind of the two things that first you want to look at, and also there's a lot of conversation around this, and most people agree that we're actually not putting enough on our face to be helpful with that moisturizer. And so you recommended it's about half a teaspoon of sunscreen on your face and neck. And so I don't personally put that much moisturizer on my face when I'm doing my skincare routine, and so you're probably just not getting enough of that SPF, that protection on your face when it's just within your moisturizer.
Okay, that's really good to know. But speaking of skincare routines, I'm someone who wears makeup when I'm going into the office, for example. So if I do wear makeup and sunscreen, do I put on the sunscreen before I put on like my foundation, or do I put on the sunscreen after? Should I wait in between applying the different lotions, for example? Like I wash my face, I have my moisturizer, then sunscreen, or what is the order?
Yeah, so you do want to wait in between sort of applications of lotions. And so you kind of think about putting the lighter things on first. So if you're doing a serum or an oil, you put that on, let that sort of soak in, give it some time. And then you would put moisturizer on, let that sort of soak in, and then you would put your sunscreen on. Although there is a little bit of debate in terms of like a chemical sunscreen versus the physical sunscreen, so like the zinc or the titanium oxide. Some people say put the sunscreen on. If you're doing a chemical sunscreen, you would put that on before the moisturizer so that absorbs into your skin a little better, versus if you're doing a physical sunscreen, you would put moisturizer on and then you would put the sunscreen on. But I think kind of depending on which camp you're in, you still would want to wait in between applications of the lotion. So kind of think of it like paint drying, where you put a coat on, wait, and then put another coat on. And then as far as makeup, so what it seems like everyone can kind of agree on is that you put the sunscreen on, wait, and then you would put the makeup on. And so kind of makeup is the last thing that you would add so sunscreen would be sort of a base layer, and then the makeup would come on after that.
Oh, that's great to know. I use a mineral sunscreen. And for those of you who are still kind of on the fence about sunscreen, another reason I use it year round is it serves as a great primer. I have naturally oily skin, and I've learned that when I put sunscreen on before I put my makeup on, it kind of primes your face for that makeup. So if for nothing else, if you're not afraid of skin cancer, but you don't want to look oily in pictures, let that be motivation for you to put your sunscreen on in layers, put it underneath your makeup, and let it last. I know some folks are asking, so I'm going to reiterate, reapply sunscreen at SPF 30 or higher every 2 hours all year round, so long as there is visible light. That includes your phones, oh my goodness. But definitely when you're stepping outside with the sunlight. And that is what has been pushed and advised by our experts tonight, for those of you who are asking. And I'm sticking with you, Dr. Pogue, as we move to sunglasses. Are all sunglasses created equally? What should I look for when buying sunglasses?
Yeah, so all sunglasses are not created equal. And some of you might be thinking, well, the more money I spend on my sunglasses, the better they are. And that's actually not true either. And so when you are looking for sunglasses, whether that's at the dollar store or you're, at a high-end shop somewhere, you want to make sure that it has, usually they'll have a little sticker on them that says UVA, UVB protection, or it might say UV 400 protection, and UV 400 is kind of encompassing UVA and UVB, those rays. And so whether they cost you $2 or $200, if they don't have that sticker on them, then they're really actually not protecting you from the UV rays. They're making the sun dark, which helping with that glare, but they're actually not helping protect your eyes from the UV rays. In fact, they could be harming them more, because when our eyes are exposed to more dark, our pupils dilate, which allows more light to come in. And so you actually might be exposing your eye to even more UV radiation if those sunglasses are not protecting your eyes. And so it's kind of like SPF 30 or higher. With sunglasses, we want to make sure it's broad spectrum UVA, UVB protection. And then also, because we're thinking about the skin around our eyes, you also want to think about sunglasses that wrap around and they're not letting that light come in from the sides. You want to make sure that you're getting that skin protection as well from those sunglasses.
Again, I did not know that about the eye dilation. I knew that our eyes dilate when it's darker. I did not know that the eye dilation can make us more vulnerable for UV light entering into our eyes. So that's really fascinating and important to know. Look for the sticker, not the tag or the price tag. That's the wrong sticker to focus on. Or you could focus on both. Look for the sticker that indicates UVA or UV protection, because that's what we're concerned about when we're talking about sun protection for our eyes. Now, Dr. Faustina, Dr. Pogue kind of mentioned this at the end, but if we do wear sunglasses, can that help prevent skin cancer around our eyes?
Yes, it can, especially if you get the wraparounds. Yeah.
Awesome.
Nice, big, glamorous frames.
Yeah, so again, if you want to keep it fashionable, I know for a while the skinnies were in. I really like the little skinny cat eye ones, but you can wear those indoors. We need to be practical. We need to protect ourselves. And nothing's fashionable about protecting yourselves. So the big wraparounds with the indication that they're UV protection. Dr. Pogue, are there other ways I can protect my eyes besides sunglasses, for example?
So you can also wear, just a really wide brimmed hat. If you're like me, hats don't quite fit on my hair very well, but, wide brim hats to help protect you from the sun, visors, things like that. Also, I know some people, a lot of us, we wear glasses also. And so you're saying, well, if I wear sunglasses, I have to either swap out my glasses, or maybe you don't want to pay for prescription sunglasses, which is a good option, but you want to wear your glasses all the time. You can also get transition lenses on your glasses. They're photochromic, photogray lenses. And so what's nice about those is that when you walk outside, the clear lens actually gets dark, and that automatically comes with a UV protection on it. And then you go indoors and it gets light again. And we really like this for kids, especially because, they're out on the playground during school days. They're probably not going to be, putting on sunglasses to go out. And if they're already wearing their glasses, then, they're gonna get some of that protection from those lenses getting darker and having that coating. And some people don't like those, but you could also get a UV coating on your glasses too. And so that's just a clear coating that will help filter out those UVA, UVB rays as well. And so when you order glasses, you could ask for that. However, if you get polycarbonate lenses or you get high index lenses, which if you have a really high prescription, it'll thin those lenses down, the high index, then those automatically come with UV protection in them.
So before we continue to talk about lenses, I actually kind of want to backtrack to something that Dr. Pogue mentioned. And Dr. Faustina, maybe you can expound on this. She mentioned different types of sunscreen. She mentioned physical, and I think she mentioned chemical. And I don't know that the audience, I'm going to use them as an excuse, I don't know that I am familiar with the difference between the different types of sunscreen. So if that's something Dr. Faustini you want to talk more about, or Dr. Pogue, you can expound on what you meant. But what types of sunscreen should we be looking out for? I'm familiar with mineral sunscreen. Again, I've heard you mention chemical, I've heard physical mentioned. What are the different types, and are certain types more effective than others? Sorry, you're on mute, Dr. Faustina.
So sorry. Probably the one that's the most protective is actually the titanium dioxide ones, which is that old school white lotion. But a lot of us don't like to use it because it stays white when you apply it to your skin. But it does give you the most formulated protection from sun damage and from visible light. I just think that we've all kind of moved to ones that were a little bit more amenable to the appearance as well as the protection.
Okay. So for the mineral sunscreens that have become more and more popular, are those effective at all? Should we?
Absolutely. Yes. Okay. No, you're doing the right thing. Everything you described, Joyce, sounded fantastic. So just follow Joyce's regimen.
Can I call my husband in here? Let's pause. So if you're out on the market, maybe you're at Target, maybe you're at Sephora, is where I get my sunscreen from, and you see mineral, that is also effective. So fear not, for those of you who are melanated and are afraid of that kind of ashy appearance. Mineral sunscreens, I think, are really great for blending with our skin so that we don't kind of look ashen. Another thing that really came to my mind, I used to get gel manicures. And for those of you who may not be familiar with gel manicures, you have to cure them under a UV or an LED light so that they dry and that they set. Do either of you know of any risks involved with gel manicures? I know getting our nails done in our community is really, really popular. It's a big part of our culture. Should we be concerned about putting our skin, our hands under these UV lamps? Should we be putting on sunscreen beforehand, or is there just not enough evidence yet to speak to that concern?
Yeah, I don't know. Now, it seems to me that UV risk is UV risk, but I don't know what level those lights are emitting. It is true that although skin cancer is more common in sun-prone areas, it can still appear in other areas, and especially on darker skin. One of the things we like to tell people is to look at your nail beds, look for any streaks of pigment that are irregular, because those can be signs of an early skin cancer that wouldn't be detected otherwise. Look on the soles of your feet, look at the lower legs, even in the areas in your groin that may not be sun exposed, you still have risk of skin cancers, even the inside lining of the mouth. So I was thinking when you were saying that, you're putting your fingers under the UV, I don't know what level of UV that's really pushing, but I would think there is some relative risk, and that we should always give ourselves little breaks. Just like if you're wearing false lashes, you give yourself a break after so many weeks or months with the lashes. You go without them for a few weeks. Same thing with contact lenses. You take a contact lens vacation. Same thing with your nails. You should kind of give yourself a little vacation from the different applications so that your natural nail can recover. And then that's a good time to inspect and make sure that you don't see any changes under your nail beds.
Good to know. Anything to add to that conversation, Dr. Pogue? Or is that comprehensive?
Yeah, Dr. Faustina, I think you covered it for sure.
Yeah, and I think there are so many things that we're still discovering that we don't know. I don't know that it hurts to put some sunscreen on your hands before you get your nails done. I love the idea of giving yourself a break. I've since moved to just normal polish. It's still a chemical, but it's not under UV lights, just for my own peace of mind. But again, things to be aware of. And I know that we have some questions in the chat. Dr. Pogue, you mentioned wearing a large brimmed hat when you're out in the sun, and someone asked if treated sun hats really work. So I'm guessing that there are hats that have special sun treatment that could protect, or maybe we don't even have to get that specialized for it to be effective. Any thoughts on that?
Yeah, and I mean, and there are, you see shirts and things too that are, specifically formulated to sort of, protect against UV rays, because technically, I mean, yeah, the UV rays can go through our clothes and things too, and so, they're not 100% effective, and so, yeah, things that are specifically formulated for protection from UV rays are definitely going to be more effective than those that aren't. But I think any wide brim hat or anything is going to be more protective than nothing at all, for sure.
Are there certain clothes or colors that attract UV rays more than other clothing types or colors?
Not that I'm aware of, but Dr. Faustina, feel free to jump in if you know.
Yeah, and like Dr. Pogue is describing, there are clothes and hats that have been treated, and thank you for the person who brought that up in the chat. There are fabrics that have been treated with some further UV protection, and especially for those folks who are playing sports outdoors, sometimes the sleeves that have UV protection in them can be very helpful. In general, lighter colors are less attracting to the sun. Dark colors are a little bit more. So if you're wearing black out in the sun, you are actually probably capturing a little bit more of that heat.
That's good to know. And I do unfortunately wear a lot of black in the sun because I tend to sweat a lot and I don't like when it shows. But maybe we're not saying you cannot wear black in the sun. We are saying be extra mindful of how you're protecting your skin with certain colors that you are wearing. So Dr. Pogue, back to you. I'm a contact lens wearer, and I was wondering, and I'm sure others would like to know, can you wear contact lenses while you're swimming? How does that affect our eye health? What concerns are there, if any?
So we don't recommend wearing contact lenses with any water activity in general. And I know, specifically during the summer, we think about being at the pool or if you're close enough to a body of water, right? You're at the lake or the ocean. You don't want to see blurry when you're doing those activities. But I always tell my patients that, a couple of hours of blurry vision is worth it compared to a lifetime of blindness. And so there are microbes that live in the water, kind of think of them almost like little parasites that Acanthamoeba is one of the biggest ones that, normally they're not so bad for our eyes, but whenever we're wearing a piece of plastic, that contact lens, that Acanthamoeba can sort of just attach itself to the contact lens, and it says, "Oh, we've got this nice environment. It's warm, it's wet," and then it starts, kind of just this big infection on your eye that is really hard to treat and can take a lot of time to treat. Eye drops, sometimes even IV medication and things like that. And in the end, it potentially can result in just a really big scar on the front of our eye that, so we think of blindness, but really the scar is what's causing the blindness. And so you potentially need a corneal transplant, or, you kind of go around life with a lot poorer vision than had you just spent a couple of hours without your contacts in when you were in the water. And that also applies to showering too. So, if you're going to be showering, we do recommend taking your contacts out, or hot tubs, basically anything with water. You don't want your contacts to come near it.
So I know exactly what my nightmares tonight will consist of. Terrifying. So maybe don't do everything Joyce does, because I was on vacation recently with my contacts in. But here's my other question. I did have UV goggles, like swim goggles on.
Nice.
What's the place of contact lenses and those swim goggles are kind of like those bug eyes that really suction cup to your face? Or is it just like take them out? Those goggles aren't totally waterproof. Any thoughts on this?
Yeah, I would say don't risk it. I mean, yeah, you ideally, right? They're nice, vacuum sealed, nothing's getting in there. But it's one of those things where I would say not worth it. And so to take the contacts out. Good news though is that there are goggles that you can get your prescription in them, and so you can talk to your local optical, and a lot of times they can order them for you. But you can also ask them for prescription goggles, which then kind of take care of the problem of not being able to see when you're in the water as well.
Okay, we'll stick to that alternative. So much to learn here. What a rich conversation. I know we're going to turn to children and goggleware in a little bit, but I'm curious to know if any of you have a sense of what populations are most vulnerable to eye damage when it comes to the sun and kind of sun protection. Should we be hyper vigilant when it comes to children? Should we be hyper vigilant when it comes to the elderly as our eyes start to deteriorate? Or is it just like hyper vigilant? The exposure, the risk is the same across the board, regardless of age, when it comes to eye protection and the sun. Any thoughts? Or let's just practice care and safety?
Yeah, I would say practice lifelong, because a lot of the damage just builds up over time. So it's not that one is more at risk, it's that the damage has built up. And so we're going to see more damage as we get older, just because we have a cumulative of sun damage.
I see. Can either of you speak to sunscreen and babies or sunscreen and children? I'm a mom at the beach. Should I be using the exact same sunscreen that I'm applying on myself, on my infant child, or my toddler? Or are there special formulations that we should be mindful of when it comes to children and infants?
I think they have some baby sunblock out now that maybe is a little bit less inflammatory to the skin with equal amounts of SPF.
Awesome. Equal amounts of SPF, but be cognizant of the ones that are sensitive to children and babies that are still kind of forming and developing that external skin barrier. That's good to know. Okay, so Dr. Pogue, should my child wear goggles while swimming? We kind of hinted at this, but I want it to be abundantly clear. How about adults? So I mentioned goggles because of contact lenses. My husband doesn't wear eyewear. Does he need to wear goggles when he swims? Do children need to?
Yeah, it's not necessary, would I say, but it does help protect your eyes. If you're at the pool, you're essentially in bleach water, right? And so those eyes are just going to get really irritated if you're opening them up underwater, or you're just, water kind of dripping into them. And so the goggles are going to be really helpful with that. Kids or adults, and then same thing with the ocean or any other natural body of water. There's just a lot of stuff in there, right? And so, protecting your eyes is going to be helpful. And potentially you can get an infection from pool water or other water, and not just the acanthamoeba infection, and so that is going to help protect those eyes from that. Plus, you can open your eyes underwater at that point and just have a little bit clearer vision of where you're swimming and where you're going to.
Great. So I'm hearing that's not completely necessary, but it's a good safety precaution to have. And at the very least, it will keep your eyes from becoming irritated, because a lot of us are swimming in either salt water or water that's been treated with bleach. So definitely encourage, just for overall comfort and safety risks, even if they're lower if you're not wearing contact lenses. So I want to turn again to skin cancer and the eyes, which is a correlation or a connection that maybe not a lot of us think about often. So Dr. Faustina, What do I look for to know, for example, if a bump on my skin could be skin cancer?
That's a great question. We will sometimes describe what we call the ABCDEs. We look for asymmetry. Normally, a benign bump, a bump that isn't worrisome, tends to be nice and round. We look at the borders. So if it's irregular in shape rather than round and symmetric, if it's starting to get irregular around the edges, then that's worrisome. If there's multiple colors, like when we look at a mole that we've had lifelong, it's one pretty brown color and it's very symmetric. You could almost take it and fold it upon itself. It's that symmetric. Anytime that it's light and dark and light and dark and different colors, kind of variegated in its appearance, that can be worrisome. If it's growing, so D is the diameter. If it's growing in size, then we worry. And then E is kind of, we'll sometimes call it evolution, like in its size or its shape or its color. If it's starting to get lumpy, bumpy, and elevated, that's worrisome. So the ABCDEs, asymmetry, borders, color, diameter, and any evolution or elevation, those things are worrisome.
I appreciate that kind of acronym, if you will, ABCDE. It's a good way to remember asymmetry, order, color, diameter, and elevation or evolution of the bump. That's a good self-diagnosis. We're not asking you to be doctors, but it's a good first step before you go in and you see a doctor. And I want to go to, okay, so then what happens next? As just a way of validating people's experiences, I know, especially in the Black community, there is a lot of concern with engaging with our healthcare professionals. My mom is
Yeah.
a nurse, and she still gets nervous when I
Yeah.
want to go in for a routine checkup. So
I really want to I really want to empower us.
awesome.
You have every right to be heard and to take your time and describe what your needs are, to describe what you're experiencing at home, because that's what the doctor does not know. They can examine you and they can see what's happening on that day, but they don't know what brought you here today, what you've been experiencing at home. It's okay to take notes. I like to say write it on the, on the refrigerator, a little note, but then we sometimes forget the note. So put it in your phone or even record it in your phone. So then you can play it back to yourself. Bring a friend or bring a family member with you so that they can check you and make sure. Don't feel nervous about asking that question. Go ahead and ask the question. I would say start with your primary care doctor if you have access to your primary care doctor. Depending on your insurance plan, you might have to go to your primary care doctor to get a referral to a dermatologist or to an ophthalmologist or an oculoplastic surgeon like myself. A lot of my patients come to me from their other eye doctor, from their optometrist, or from their ophthalmologist, or from a plastic surgeon because it's too close to the eye. So I share patients with back to the other specialists when it's further away on the other parts of the skin. If you feel like you see something suspicious, go to your doctor and ask them to examine it, and don't let them blow you off. It's okay to say, here's what I noticed, here's how it's different, this is what worries me. And I have to say this out loud to everyone online. If they are not paying attention to you, or you feel like they have not given you the attention that you need, say something, be polite, advocate for yourself, and it is okay to go to a different doctor. If they're not paying attention to you, you need the attention that you deserve, and that might not be the right fit for you. Unfortunately, it makes our work harder because then we have to push to advocate to get another appointment. It takes time. Sometimes it takes time off of work, and it costs money. Co-pays are not cheap. We realize that. And that's why I say take a moment to see if you can reset in that appointment and say, listen, I really need you to hear me because this is very important. This is what I'm experiencing. If you can reset in that one appointment, you will be surprised how often you can get the attention that you need. Don't be bashful about it. But if you can't get through on that appointment, see someone else.
This is exactly why we have these conversations. I want to give that a round of applause. We're not done, but I am just so moved by that, by what both of you are saying. I actually got goosebumps when you were speaking. This isn't to scare you, this is to empower you. You have the right to access healthcare and healthcare professionals that are going to listen to you. You have the right to take up space in the room, which is a personal difficulty for me. Doctors are very busy. They'll be the first to tell you, but most doctors are committed to your well being. Take up space, take up time. This is your health. And if it's hard for you, I love the suggestion of writing things down, but more importantly, bringing a friend or a family member who may push and advocate you for you in a way that you maybe cannot advocate for yourself, but take up space and be empowered. The earlier they can catch things, the better the chances for positive and healthy outcomes. Thank you so much for that. A couple more questions. So, how can we prevent getting skin cancer? We've talked about sunscreen, but are there any other ways to that we can look towards prevention, Dr. Faustina?
Oh gosh, sunscreen, sunblocks, sun protection from clothing, hats, floppy hats, limiting your time outdoors, being aware of how you feel, or how much time you're spending out there, how much glare you're experiencing. And then, like you're saying, the most important thing is when you notice something, go ahead and get attention as soon as possible. Because part of the reason why we are frequently suffering from more serious skin cancers is because there's been a delay in diagnosis, and then it has spread, and so that's a concern.
Yeah, and I know for a lot of my patients, they will come in and they'll say, "Well, I don't want the referral because I'm nervous about what it could be," and and it's kind of one of those things where we're like, "Yeah, but if we wait, then it's only going to get worse." And so, yeah, so as scary as it might seem, right? Yeah, if you're concerned about something, try to get it checked as soon as possible, because that's going to ideally, earlier prevention is going to be less severe as far as treatment and things too.
For those of you who see a doctor annually, have them do the skin check also. And that way, if you're just getting one annual exam, let them start checking your skin early. And that way, if they do see a change, then they can go ahead and get attention earlier.
So what about those of us who are getting older, Dr. Faustina? I noticed especially the Black community, a lot of folks may get these brown spots on their face, along their neck. Are they freckles? What's going on?
I know, right? They're so common. And so good news, usually they are not cancer, okay? But what happens is the melanin just starts to kind of piggyback, and then we get moles and we get all these other little bumps, right? Some of them are those flat plaques that I'm going to go like this. They're all over around our necks, right? And some of them get a little itchy and scratchy. Those tend to be benign. Sometimes they can just be skin tag-like. They can be removed. And other ones are flat and kind of itchy. Those can be removed also. And some of the reasons why it's a good idea to remove things, even though they're benign and not skin cancers, is because they can get scratched and scraped, and then they can get infected, and then they scar more, and so they can be very troublesome. For gentlemen who have them on their faces and then they're shaving every day, they can scrape them and scratch them and get, recurring infections and scarring on the face. So it's a good reason to maybe have them surgically removed with precision to minimize, even though it'll leave a mark, it'll be a much more precise mark than the recurring, trauma of scraping and scratching them. When you're wearing a necklace, sometimes it can tug and pull, or your clothing can tug and pull on those. So those are other reasons that you may want to have them removed.
So fear not, it could just be melanin clusters, but it never hurts to get that also checked out by your doctor and maybe your annual checkup. But again, it's nothing to be afraid of either way because resources are available to you. Dr. Pogue, one more question to really cement this link between sun protection and our eyes. What eye complications can develop due to sun exposure? In addition to the topics we discussed, what other risks to the eye are concerns from the sun?
So yeah, so we talked a lot about, the skin itself around our eyes, our eyelids, but the eyeball itself can also be affected by sunlight, by UV radiation. And so we kind of think about kind of the front of it all the way to the very inside, to the back of the eye. And the front of the eye does a really good job of absorbing UV radiation. And so as it absorbs it, the front of the eye, we can get what's called a pinguecula, which will cover sort of the white part of the eye. There's a tissue, the conjunctiva, covering the white part of the eye. So it's a little bit of an elevation right there. It changes over time with excessive UV exposure, and it can actually grow onto the cornea, the clear part of our eye. And as that it's called the pterygium, and so as that pterygium grows, it can become inflamed, and it can just be really irritated. It's not dangerous per se in terms of like a cancer, but it as it grows, at some point we would want to remove it because it can actually continue to grow all the way across to the other side of the eye on the cornea. And as we remove it, it will actually generally leave some sort of scar. So we want to remove it sooner rather than later. So that way that scar doesn't affect the vision too. And so that would be something that, yearly eye exams would help us continue to monitor that and make sure that they're, when we need to refer, we can do that. And then as that UV light goes through the pupil, it hits the lens of the eye, which as the UV radiation hits the lens does a really good job of absorbing a lot of that. And then we start to get this oxidative stress. We kind of have heard about free radicals and things. And so the cells of the lens actually start to change over time, and a cataract can develop, which is just a clouding of that natural lens we're born with. But cataracts happen naturally with age, and some of that is that UV exposure. But if we're out in the sun a lot, without protection, we find that cataracts form much quicker in patients who don't have that UV protection. And so, cataracts, thankfully, we can remove with surgery, and, that generally will improve the vision. But we definitely want to, with any surgery, there potentially are complications. So we want to avoid that if we can. And so using sun protection will help slow those cataracts, that cataract growth down. And then as we continue inside the eye, we hit the retina, the tissue covering the inside of the eye. And there's a structure called the macula that as that UV light goes to the macula, once again, it kind of causes the cells to change, and macular degeneration can form, which is deposits in that macula. And those deposits grow over time, and that can affect our vision. And unfortunately, that we don't really have a cure for at the moment. We can take vitamins to slow it down and to kind of help the progression, but unfortunately we can't do much to make it go away. And so that's another reason that we want to protect our eyes, is to help prevent that as well.
Awesome. There are so many reasons to protect our skin and our eyes, and there is a link to the two. So as Dr. Faustina said, and as Dr. Pogue reiterated, there's nothing to be afraid of. We want you to be empowered, and we also just want you to be informed. Use sun protection every 2 hours, at least SPF 30. You can wear a sunbrim hat. You can wear fabulous large shades that are UV protected and UVA protected. Use sun protection all year round. And more importantly, share this conversation with your friends, your families, and other communities, because you never know who you're going to save with this information. Dr. Pogue, Dr. Faustina, thank you for this really enriching conversation. And thank you all for those of you who tuned in. We hope you have been as informed as I've been. Thank you and have a great evening.